This podcast represents my opinion and the opinion of my guests. This is not medical advice, and I am not establishing a patient-physician relationship with any listener. The content here should not be taken as medical advice. The content here is for informational purposes only, and because each patient is so unique, please consult your healthcare professional for any medical questions you may have.
Welcome back, everyone. We're here for another episode of the Not Your Doc podcast. I'm your host, Vanessa, and we're here with Mr. Not Your Doc himself, Dr. Charles Tadros. How are you doing today?
Very well. The early November, and it feels like spring. It's gorgeous outside here in St. Louis.
We're getting pretty spoiled. I definitely agree with that. And while it is 70 degrees sunny and beautiful here in St. Louis right now at the beginning of November, we're also at the beginning of respiratory virus season. Hooray!
Yep. Not just little respiratory virus. We got a lot going on.
Exactly. So today, Dr. Tadros is going to give us evidence-based information to help us be prepared and make good decisions for ourselves and our families during this delightful time of year. We're going to cover the difference between cold, flu, COVID, and RSV. I think obviously that's going to be a big one because their symptoms can be very similar and hard to tell between. We'll also review prevention guidance, including vaccines, as well as available treatments. And Dr. Tadros will help us understand what to do if we start experiencing symptoms of any of these illnesses, including a review of COVID testing and isolation protocols. So it sounds fun, right?
Yeah.
Whee! Okay, yeah, this is like a straight-ahead medical topic today, so all about Dr. Tadros and what you're bringing us. We've got some great resources to share as well. So, Dr. Tadros, let's jump right in. Cold versus flu versus COVID. It seems like all of these viruses have basically the same symptoms. So can you help us understand the difference and how I tell them apart?
Sure, and we're going to have the infographic posted from the NIH, and it's you've taken the wind out of my sails. It's exactly correct. These three big viruses that we're already experiencing in the United States, the cold, and the word cold means typically a head and symptoms, and it'll be sore throat, runny or stuffy nose, sneezing, a little bit of coughing. Sometimes the coughing is from drainage. Sometimes it's because the virus has gotten into the bronchioles and
Does that count as upper respiratory?
Right.
Okay,
That's upper respiratory. Lower respiratory people think more as pneumonia, occasionally bronchiolitis, but pneumonia is lower respiratory. Okay. Everything else is the upper respiratory is kind of the head typically, and some of the milder chest symptoms. So the common cold, multiple different viruses that do it. There's no test for the common cold. There's no blood test. There's no nasal swab. People typically don't feel bad with a cold. People sometimes confuse it with allergies because sometimes allergies in the fall also may give you a sore throat from drainage. Not usually. Runny or stuffy nose, absolutely. Sneezing, absolutely. Cough, especially if you have asthma on top of your allergies in the fall. Sometimes people confuse the two. The differentiation between allergies and just a head cold is itching eyes, itching palate, itching nose, itching in the ear sometimes. So that histamine release tends to go with itching. That tends to go with allergies.
Yeah, that makes sense.
So that's the first thing. Colds, nobody dies from a cold. Uncomfortable, easily spread person to person, but nobody dies from the cold. A lot of people want to call everything a cold or their allergies because they don't want to have to deal with the flu or COVID.
Right.
So no mom wants to bring their kids home from school because they're sniffling or sneezing. So and especially if people already have a known history for, annually getting their fall cold, or usually if it's anything that repeats itself about the same time every year, we have to worry about allergies. It's stereotyped. So that's important to notice. If at the beginning of every spring or the middle of summer or early fall, whenever it's typically most people will have outdoor allergies. Those are seasonal allergic rhinitis, runny nose, etc. But they're seasons. Perennial means year round. and perennial, it means there's something in every season that you're allergic to. And you say, well, what about wintertime in the climates where it gets cold, like we are here in St. Louis? And that oftentimes will be something indoors that you're allergic to. Sometimes people bring plants indoors. Sometimes it's just dust mite feces. I know it sounds gross, but it's not just, when people say they're allergic to dust, it's actually not just dust. It's the mites that live on the dust, and it's not just the mites that live on the dust, it's the feces of the mites that live on the dust. It's
delightful.
Yes.
Pets as well. Right.
So some people will be allergic for four different seasons per year. Colds are typically brief. The head colds are typically brief, typically less than a week to 10 days. Just a little bit of discomfort. Nothing to do about it except something to help dry up the nose and help. That's really the main thing. And sometimes a cough. With very young kids, be careful about giving over-the-counter cough syrups. The American Pediatric Association several years ago came out and said a lot of the over-the-counter medicines that are indicated for kids probably are not worth it, not helpful, and may cause problems, especially cough syrups for kids, so for children. So even though it's over-the-counter, oftentimes pediatricians will not want you to have anything for a cold if you're a young child. So a lot of fluids, a lot of rest.
Right.
So then we go on to the flu, and the flu season typically, roughly, actually it's expanding to practically year-round. People forget that back in 2009, H1N1, the flu that came out in the summertime.
Yeah.
So we can potentially have year-round flu, but typically the peak flu season, is typically about October, November through about February, March here in the Midwest. And the flu includes not only that sore throat and the stuffy nose and the cough. It doesn't include sneezing, but it includes other things, the fevers or chills. Some people can have no fevers and have the flu. Headaches, muscle aches, feeling tired or weak, short of breath, and sometimes even vomiting and diarrhea. Back whenever I was younger, we could tell the flu practically over the phone because it was hard. 1 minute you were fine, next minute you were shaking chills and high fever.
Very sudden onset.
We would say you were hit by a truck. It was just one minute you're fine, next minute you were bowled over. Yeah. It's not so much the flu in the last 10 years plus has become sometimes without fever and sometimes with GI. Anybody in the old days that had GI diarrhea or emesis, throwing up, was not the flu. But nowadays it could be influenza. People kind of mistake the word flu. The flu and the word flu is short for influenza. Influenza is a virus. There's something else that's called H-flu, Haemophilus influenza, that is not flu. It's a bacteria. It's not. So that's because people get the Hib, the Haemophilus influenza immunization series as a kids. That's a bacteria. Okay. So it's separate than the influenza or the flu that we're talking about. So the flu is also easily transmissible. We look for the type of flu coming around into the United States through the Western world. They do predictive models that starts somewhere in Southeast Asia. They have decades now of information of how it migrates, how it's transmitted, migrates across the world, and they can do fairly good prediction about when it's going to be hitting.
And so do they modify vaccines to target what they think is going to be the strongest?
Right.
Or?
So that's why in the old days being a few years ago, it's not that much, we grew them in eggs, and you had to have a long lead time, many, many months to grow them in eggs. So sometimes we'd miss it. We think that something's coming across the ocean, and we predict it, and we grow the vaccine for the influenza in eggs, and we would miss it. It would change. So
I've heard it said the vaccine didn't work this year, or the vaccine missed this year.
Antigenic shift and antigenic drift as its own podcast. So now with the mRNA vaccines, we can turn around and we can now generate vaccines much faster. So we don't have needed that much of a lead time. So I think what we're going to find is that we're going to probably get better coverage of our flu because we won't need months and months in advance to incubate viruses in eggs and to to generate antibodies for vaccines for flu. Flu can kill. People don't realize this. Flu can kill from somewhere in the mid to low 10,000 range per year,
Wow.
up on upwards. Whenever we had H1N1, we're probably,
These global annual deaths are in the
right.
United States?
United
Okay.
States, I'm
All right.
sorry. Yeah, thank you for checking me on that one. But we can get annual, just a typical flu season. Last few years were not typical because we were isolating, and so we had much, much lower flu, anywhere from like 14,000 all the way up into the 50s plus thousand deaths just from flu. This is without COVID, and oftentimes, of course, it's the very young and very old that die from influenza. The very young kids who have not been immunized or who have congenital problems or born with lung and heart problems, and the very old who have immune issues and heart issues and lung issues. So those are the people that tend to be susceptible and could pass away just from the flu.
Is it the flu itself that can be lethal, or is it complications from the flu that tend to lead to deaths?
So that's a good point. Respiratory infections, whether bacterial or viral, typically cause a variety of things. So everything from lack of appetite, so people don't want to eat, so they start losing weight. Shortness of breath, so they don't have good oxygen exchange. They have to be ventilated, which means to help take carbon dioxide. They have to be on ventilators, machines to help take carbon dioxide off of their lungs. That's a waste product, and also push oxygen into their lungs. And some people, the infection causes a whole body inflammatory response. So ARDS, adult respiratory distress syndrome, and sepsis.
Wow.
So it goes from lungs to systemic. So that's from simple virus, we'll call it simple influenza,
Sure.
and certainly from other viruses too. So it's you're right. It's not necessarily just pneumonia and death, but that's typically what happens. These people you can't oxygenate and ventilate enough, and they pass away despite our best attempts.
And I know we're going to talk more about vaccines later, but I mean, just hearing the numbers and the consequences of
That's right.
not protecting against flu, there's definitely huge reasons to continue to immunize.
And obviously, for colds, we don't have vaccines. Once again, they're limited in terms of what problems they cause, even though they're highly transmissible. So people get infected and they're infectious. They can spread it to other people. Same thing with the flu. Sometimes with the flu, just like with a lot of viruses, even before, so you have an incubation period, so you're exposed, somebody sneezes, coughs, and you catch it, and you don't turn around and become sick immediately. You don't have to show symptoms immediately. But sometimes before you get sick, within a day or two before you get sick, you can be spreading the virus yourself.
Yeah.
So that's part of the problem, even if you're trying to be polite and have this etiquette. It's kind of infection etiquette where you don't sneeze or cough out loud. You do it in the inside elbow, so you don't touch your face.
The vampire cough.
Right, right. So, we have immunizations for the flu, like I said, and we don't have anything for the cold.
Yeah. Okay, so I know you were talking about the incubation stage, and I think that we got a lot more awareness of that learning about COVID-19. So tell us some more about COVID-19, how it differs from the flu and cold.
Well, the COVID looks like almost practically exactly like the flu, and that's another problem. And so this is extremely important for people to understand. They have to be tested. The doc can't tell over the phone, or a nurse practitioner can't tell over the phone what you have. In the old days, like I said, if you had the flu, it was obvious. And practically some docs, if you were healthy, didn't want you to come in. They said, we can do this and that over the phone. You don't need to come in and infect other people in the office, et cetera. But the COVID, unfortunately, and especially if you've been immunized, you have a blunted response. You don't have the high fever. You don't have all the big raging symptoms, so it could be much milder. And it could mimic somebody who's had shots for their flu. And also severe flu can look like severe COVID initially at the start. So it is very confusing. So you have to be tested. And both of these are nasal swabs in the doctor's office or urgent care, ER, is nasal swabs for those. And those are rapid antigen tests. So for the COVID, same thing: fevers and chills, headache, muscle aches, feeling tired or weak, exhausted, sore throat, runny or stuffy nose, cough, shortness of breath, vomiting or diarrhea, and especially early, the very first COVID strain, we had loss or change of smell or taste. which doesn't really happen with colds or flu.
Right. Absolutely. That's certainly a unique one. So COVID, they're at-home rapid antigen tests, right? And then
That's right.
But more accurately, you can go into your doctor's office and get a PCR test for flu and COVID at the same time, right?
Right. Yeah. So the tests that they have in the doctor's office, the rapid antigen test, the nasal swabs, are just as good as the ones that you have at home. So that's important. What the doctor's office is able to draw blood and stuff and do a PCR, polymerase chain reaction, which has a send-off test. You can't run it. He or she can't run it in the office, but they can get it or send you to the lab if the lab is allowing you to walk in. So yes, that's correct.
Cool. All right, so we've also heard a lot recently about extremely high rates of RSV among children, leading to many children's hospitals across the nation becoming full to capacity with sick kids. So Can you tell us about RSV? I know it's another respiratory virus. I wasn't really very familiar with it before this current wave. So help us understand symptoms, treatment and prevention.
Yeah. RSV, respiratory syncytial virus,
syncytial, is that what you said?
Yeah.
Syncytial?
Syncytial.
Syncytial. Okay, got it.
Syncytium is just a fusion of two cells. It's under a microscope, actually. If you look under, this wouldn't be regular light microscope, it'd be electronic microscopy. Well, actually, the virus you can't see, but the cells that infect kind of fuse together, so syncytium. And that's what it looks like under these lung cells, the lining of the lungs.
Wow, interesting.
So that's where it comes from. Also, respiratory virus, very contagious. And you and I probably heard about it because you'd hear about RSV for your young nieces and nephews, et cetera.
Yeah.
We wouldn't hear about it so much for adults. But this year's been especially bad. There's a couple of theories. One of them is that we've been isolating from each other for a couple of years now. Finally, we're all together. We've had a couple of years where we're not getting antibodies revved up, and so it's hitting us a little harder.
Sure.
So this year, I think it was also last year too. It's been showing up in summertime. Typically, it's more wintertime, so it's been showing up a little bit sooner in the United States. Also, the very young, premature babies under 6 months of age, very old, especially if they have heart and lung disease. Also, pediatrics less than 2 years of age that also have heart and lung disease that are congenital are at risk for this RSV, landing them in the hospital, landing them on a ventilator, and potential death.
Wow, yeah. Can you say a little bit more about this, the kind of the effect of COVID isolation and lockdowns on our general immunity towards some of these things? I know you said that typically we would have more of an antibody response because we'd be having little exposures that was triggering our body to produce these antibodies, but we haven't been having that. Yeah,
that's one of the current theories, is that why we're getting hit so hard. And we know for at least a year, if not 2 years, our flu numbers were very, very low. Everybody was isolating, we're masking, we're washing their hands. It goes to show you it works for all sorts of viruses.
Yeah, exactly.
It's not very fun socially. It's not very fun during the holidays and stuff. You can't hug and kiss people. You can't hang out with people. But it turns out that, isolating does help prevent all sorts of transmissions, especially these viruses. The problem is that we have probably what we've discovered over many years is that the human body, in order to survive out in the wild in our society, we have to have small exposures, not lethal, but we don't want to do anybody in, but small exposures where our immune system gets trained to recognize select things. And sometimes there's some crossover. So you may not be exposed to a virus, the specific virus, but you may be exposed to something like it. So your body has a partial antibody against the new virus. So that's one of the theories, of course, of why we immunize people with flu. And next season it's a different flu strain. But we may have some, over several years, we may have retained some antibodies that may attack the new flu bug.
That's interesting. Like so getting a regular flu vaccine can build immunity to other strains,
that's correct.
At least to some extent.
To some extent. Right. It's not totally protective. But yes, so we believe. And the same thing, the natural wild type immunity, which is that you're exposed small amounts, and please don't do this whenever with hepatitis or HIV.
Right. Let's not test this theory.
And this is the problem we got with COVID, is that people believe that the traditional way of like getting chickenpox, when we were growing up, everybody would get together. If one kid had chickenpox, the parents will have them all play together, and within a few weeks, everybody would have an outbreak and get it done with whenever the chickenpox grabbed over. That was traditional way.
We definitely did that.
We did.
When I was a kid,
that was a traditional way of doing things before we got the chickenpox vaccine about 20 years ago. But this does not work for a lot of viruses,
Right.
hepatitis B, hepatitis C, HIV, all sorts of COVID. This does
Flu.
not work. Flu
Yeah.
does not work. So you can get antibodies, but they're not protective. So
Yeah.
your body can show up as as antibody levels, IgG, which is the long-term antibody levels, but it's not protective in the vast majority of cases. So that's what I think part of the confusion out there.
Yeah. Okay, can you say just another bit more about RSV? I know you told us who's most susceptible to.
Right.
What are the available treatments for people with RSV and children and old people that are more susceptible?
So people that don't need to go to the hospital. Let me make sure we know what the symptoms are.
Symptoms,
Once again, runny
Start
nose,
with
runny nose, cough, sneezing. Remember, sneezing was with allergies, and sneezing was also with colds.
Right.
Fever and wheezing. So the wheezing, and then there's a decreased appetite. That's kind of special for this compared to the cold. The incubation period is about 4 to 6 days. So even after if you touch something and then touch your face,
right,
or somebody coughs on you that has RSV, it's still another 4 to 6 days before you can potentially show symptoms. And remember, for 2 days before you show symptoms, you could be spreading it already.
Yeah, absolutely.
So what happens is that you could be contagious for another 3 to 8 days after you start showing symptoms. In people who have bad immune system, poor immune systems, weakened immune systems, they can actually hold on to the virus and be spreading it for a whole month, not just 3 to 8 days.
Wow.
So I think and that's tricky, and this confuses people. It confuses the physicians. It confuses patients. They feel better. They feel better, but they can potentially still be harboring the virus and spreading it from their nasal mucosa, typically, from particles.
It's not.
Right, particles, different sized particles of I'm going to be gross, mucus and spit that we all have whenever we talk, and et cetera. So that's part of the problem we run into. For RSV supportive care. So if people become short of breath and high fevers and short of breath, whether they're very young, premature babies, or less than 6 months old, or very old with emphysema and heart disease, these people have to go to the hospital. Sometimes they have to go not just to the regular general floor, but a step-down unit or an intermediate unit. And sometimes they have to go to the full ICU if they're going to be intubated to push oxygen into their lungs and pull out the carbon dioxide.
Wow.
So there's not a specific treatment once you have RSV and you're bad enough to be in the ICU. There's a lot of supportive stuff. Now they have something for that's if you're at high risk at the beginning of the beginning of the RSV season. This is for kids. I think if they're under 6 years of age or 6 months old, and preemies, they have antibodies, monoclonal antibodies. You can get a shot every month during the flu, the RSV season. So it's not a vaccine.
Yeah.
It doesn't generate an immune response. It's actually antibodies, monoclonal antibodies that they give the
borrowing
child.
protection.
That's exactly right.
Yeah.
Extra antibodies that are generated for the baby, so to prevent if they are exposed.
Sure. One thing we wanted to point out is, we learned a lot through COVID that, we sort of thought at the beginning that COVID could live on surfaces for a very long time, and we were disinfecting our groceries and our mail and all that kind of stuff, and later found out that it was mainly transmissible through the air, through droplets. RSV can survive for many hours on hard surfaces, such as tables and crib rails. That definitely explains why. If one kid at a daycare has it and they're playing with toys, and other people are playing with the toys, it can spread like wildfire through that.
Correct.
Yeah.
Yeah, that's soft surfaces are less so, like leather and tissue paper and towels, but hard surfaces are a problem. And that you're right. We for many months people fomite, which is a transfer of viruses through surfaces called fomites, was a big issue. We did not know but you're right. Fortunately, after many months of people spending hours and hours cleaning everything and leaving things out in the garage and stuff for days at a time, we recognize that COVID. That goes to show you how how little we understood about COVID when we first, the novel, it's novel
coronavirus.
So we've known about the coronavirus family for probably 50 years, but this novel piece, we were still, a lot of people spent a lot of time and energy and money disinfecting surfaces.
Yeah, it's intense. All right, so can you talk about some available treatments for the flu? We wanted to review some of that.
Yeah, so it turns out for the flu, even if you're not at high risk of progressing and needing inhalers or needing hospitalizations or ER visits, there are a couple of products out there that can help not shorten the course of the flu, so by 1 or 2 days. So instead of a week or 10 days, you may be a little bit less, and it may lower the intensity. In fact, not a lot of people, but some people, whenever they get some of these products, within hours they feel dramatically better. They go from cough and high fever and feeling terrible to they take their INFLUENZA or their XOFLUZA, and all of a sudden within a couple hours they're dramatically better. That's how powerful some of these products are.
That's amazing.
Yeah.
What kind of medicines are these?
Yeah, so antiviral.
Okay.
So Tamiflu is the one that probably most people know.
Yeah, I'm familiar with Tamiflu.
Yep, it's a pill. Rolenza is kind of an inhaled powder, and Rolenza can be used. It's not recommended with people with breathing problems. If you have emphysema, which is chronic obstructive pulmonary disease or asthma, probably the doctor will not give you Rolenza. And then they have XOFLUZA, which has come out a few years ago, and Rapivab. So there are 4 products now that are available. Once again, for select age groups. You'll have your doctor or nurse practitioner, physician assistants.
Are any of them like more effective than the other, or why are there so many? Right.
Well, part of it, they work somewhat differently. Tamiflu was the best for years because that was the only one really. Before that was something called amantadine, which was for influenza type A only. But I believe these all for influenza type A and type B, I believe.
Okay.
If I remember correctly, and I'd have to double check so people can double check me and tell us I'm wrong. But anyway. So most people, I think, will probably either get Tamiflu or XOFLUZA. Some people, Rolenza. A lot of stuff is dependent. So these are quite expensive. A lot of these is dependent, of course, on everything from samples to typically what insurance will cover.
Sure. And Tamiflu is available in a generic version too as well, right?
Okay,
that makes sense. So how effective are these antivirals, and what are some like side effects or things to look out for?
The good news is that they're really specific to the virus. So they tend not to have many side effects. They're antiviral. So the human cells, the eukaryote, our human cells, tend not to have some of the same receptors and hemagglutinin that we see on these virus particles.
Okay.
So it's really minimal. Anything is, oftentimes they'll talk about GI upset, some of this stuff. But unfortunately, a lot of people, of course, are having tons of symptoms from their flu. So sometimes it's hard to tell. But yeah, they're actually pretty easy on the system.
So it's important to say, too, that obviously you have to get these drugs through your doctor, and you also have to be able to identify that you have the flu, and you can only get a flu test at your doctor's office or urgent care. So can you talk a little bit about the importance of doing that? Because there's a window when you need to take antivirals, right?
And that's very important. In the old days, we told people 72 hours. Really, within 24 to 48 hours, that's when these work the best. So this is when remember, you already may have had the virus in your system for several days, incubating, latent, and then before you ever have symptoms to even recognize. So then you have to go get tested, and before you typically get these types of medicines. So it's a challenge because during the cold and flu season, your doctor's already busy.
Yep.
A lot of phone calls, a lot of office visits. So that's why a lot of people end up with urgent cares, et cetera, because your regular doc is already filled up their schedule, and so you end up waiting in line. So a lot of these places where you can call ahead, and they'll text you, et cetera. They'll have you wait in the car or have you come in, so that you're not packing the waiting room, coughing on each other, which is its own problem.
Why is it worth it to be persistent if you have any of these symptoms?
Persistent in getting medicines and stuff like
tested.
that. Yeah, sure. So number one, if it's not going to cause you, so we know morbidity and mortality. Morbidity is you're sick, so you can't get up and do your housework or go to your job or take care of your kids, and then also productivity in terms of companies. So tons of billions of dollars are lost every year to these types of respiratory illnesses, and a small number of people, yes, will die from end up using ICU dollars and beds and will end up dying. So it's not just that. And the other thing is not just you. It's you can pass to somebody else who can get more sicker than you.
Yeah, absolutely.
And so part of it is a responsibility. And I know people we've had this issue for politicizing, especially with COVID, about even if you believe in that's okay for you, it's that nobody can force you to do anything. But part of this is a little bit of a social contract, a little social agreement.
Yeah.
That I'm not going to try to harm anybody else on purpose, or if I can help it accidentally, I try not to harm people accidentally. I know it's very hard, and this becomes very political. But hopefully, it decreases. Any of these medicines will decrease your symptoms and decrease the length that you're sick and potentially spread it.
Right, and infectious. Okay,
infectious. Right.
That's good to know. Can children take these drugs if they have the flu, severe flu?
Yeah, there's limitations in terms of age, and I'd have to look at some of these, but there are limitations in terms of how young you can go. But I think you could probably get down to 6 or 12 years of age.
Okay, yeah, that's good to know. Okay, so since we mentioned COVID again, can you give us another little review about COVID? I think for a long time the guidance on testing and isolation and quarantine where it was shifting a lot. But now I think we've got a pretty stable protocol for it. Can you remind people what to do in various scenarios? So first one, they've been exposed to COVID, but haven't tested yet, and they have no symptoms.
Yeah, if you haven't tested yet and you have no symptoms, but you've been exposed to somebody who knows, they called you and said, we were together last night and I've started feeling crappy. I did a nasal swab, we're positive. So because COVID is still very infectious, the Omicron and any of these variants are still very infectious, even if you've been immunized. So this is important. Even if you've been immunized, we'll want you to potentially test. So number one, it takes maybe up to 3 to 5 days to see if you get symptoms.
Right.
And if you test too early, it may be artificially negative. You may be testing at day 1 or day 2 because somebody just called you from the night before. By the way, whenever your test is day 0, or whenever you start having symptoms, if you never tested, it's considered day 0.
Right.
And in fact, that's the infographic I think we have for the CDC talks about how to count days.
Yeah.
And stuff like that.
To give a plug to the CDC's website, it is really, you can literally go in there and say how many days have you been feeling sick?
Right.
What day was your exposure? And they'll do the math for you in a very foolproof way. It's very easy to use.
And we have to talk the same language in order for people to understand. So everything from reporting for people to understand if it's worth, if they're out of the woods yet, et cetera. So that's important. And they do have, like you said, that calculator. So we want people. We'll want people to test, and if you test within the first 48 hours of being exposed and it's negative, we'll still want you to test give it another probably a couple of days.
Right,
That's correct. Remember, it's called a false negative. It's negative, but it's false because you're going to be showing up. It just happens that your body has not generated the virus so that you could pick it up out of your nose, pick it up from your nose swab. So that's an important thing.
Okay.
So that's the first thing.
And then people should wear a mask, right? During the phase where they could be incubating.
Right. Could be incubating because you could spread it even before you have symptoms, right? For a day or two before you have symptoms. That's correct.
Okay. Help us out now if we've tested positive for COVID-19 and have no symptoms, or we have symptoms.
Right. So there's Paxlovid, which is the outpatient, the only, I think, FDA-approved outpatient product right now that you may qualify for receiving. Certainly for people that are at risk of progressing for heart disease, lung disease, elderly, Paxlovid, you need to call your physician and let them know kind of where the status is and what your positivity, what your test positive and the dates. And they may or may not, depending, prescribe Paxlovid. It's an oral medicine that you take as an outpatient.
Right. It's actually two different medications, right?
Mixed in together.
Yeah.
Two antiviral medications mixed together. That's right. So it's the word antibiotic but these are antiviral. That's right. So so it's important to whenever you test whether that and it's positive, whether that symptoms. Don't just assume that that your shots are covered everything.
Yeah.
You need to please call your physician or healthcare provider and let them know, and they'll help. They should. I always want medical practitioners to explain why they do or don't do something.
Sure.
And of course, the risk of doing or not doing something.
Yeah. Anecdotally, I know several people who've taken Paxlovid when, a few days into symptoms with COVID and had a similar response as what you were saying before with some of these antivirals for the flu that almost very quickly start feeling much better.
Yeah, within a few hours, it's like an off switch for all their symptoms. Yeah, a good chunk of terrible symptoms. We want you, there's a modified isolation. If you have immunizations, we want the modified isolation of 5 days. And as long as you're getting better, that's important, because some people, just because they isolate for 5 days and they still have fever or cough and it's not gotten better, you have to be careful, because you're probably still infectious and contagious and still infectious. And they'll want you to potentially go for another 5 days wearing masks, or a week wearing masks.
So let's say that again. So day 0 starts either on the day you start experiencing symptoms, correct?
Yeah, if you've not tested, that's correct.
Or the first day that you test positive, right?
So it's the day of the test, not the day that you get back the test.
Okay, the day that you take the test.
Right.
If it's a delayed result, it's the day
PCR,
that you tested, and if it's positive, that's your day 0. So then 5 days from then, for those first 5 days, you need to isolate. You need to stay home, not be around other people. Once those 5 days are up, as long as you're feeling better, you can go about your business wearing a tight-fitting mask, right?
Right. So we want to, quarantine means you're waiting to test positive. Isolations mean you're positive.
Right.
Yeah. So we like to use words consistently. We like to use them consistently for people. So quarantine is about you're at risk and we're waiting for test results. And isolation means you're positive, and we're going to isolate, and we want to isolate you from others who may contract it from you, the infection. That's correct.
So typically at our office, we do allow patients, as long as they're feeling much better after those 5 days and come wearing a mask. We're happy to have them in the office. However, it's a great best practice to call if you have an appointment first to meet with somebody, see a physician or a counselor or something like that. See what they're comfortable with. Some people are still wanting if you have any symptoms, still to stay away for longer.
Right.
Again, this is just kind of the courtesy of dealing with COVID.
That's correct.
Yeah. Okay, so having talked about all those things, let's talk about prevention. So let's start with vaccines, and then we'll end up with good behaviors for infection prevention for respiratory viruses.
Once again, no vaccines. There are no vaccines to prevent RSV, respiratory disease. There are no vaccines to prevent the common cold. We have good vaccines, and we're getting better with influenza and with coronavirus, the novel coronavirus. So we have good vaccines for these two families. It's families, because both of them change coronavirus quite frequently in terms of the subtypes.
Sure. So I know that a lot of places are offering to do a COVID vaccine and a flu vaccine on the same day.
Yes.
It's safe to do that? It's recommended to get both quickly?
Yes. Flu vaccine in the old days, if there's some of the older folk like me, it used to be that you wanted to wait until October, because the vaccine may not last long enough through the winter. But several years ago, the CDC came out and said as soon as the vaccine is available, oftentimes in September, early to mid-September, the vaccines are available for flu, that you can go ahead and get them. Okay,
great. All right, this is good. Okay, so let's talk about just good hygiene behaviors to prevent infection. So we can reiterate that.
The important things that I don't think most people realize is the respiratory viruses. These are all respiratory viruses. Don't enter your body from your skin or from your elbows or they enter from your eyes and from your nose and from your lips or mouth. So those are mucous membranes. This is the kind of the moist areas that are on the surface of your body. So those are the three areas. So in other words, your face. And they've done studies. We touch our face hundreds of times throughout the day.
Yeah.
So it's pretty dang easy to transmit it person to person or hard surface to person, eventually to the face, eyes, nose, or mouth. So that's the key. So number one, be aware. Number two, wash frequently. Yes, you have to moisturize your hands. We don't want cracking hands as a result of washing. We don't want people already obsessive compulsive about hand washing. Literally OCD patients who have cracked hands from hundreds of washing. We have to be careful not to make them more anxious. But that's the typical thing. Avoiding people that are sick. Or if you're sick, please be courteous and don't go into public places and etc. So
wear a mask if you have to be in public places.
Right.
Yeah,
that's correct. And wear it appropriately over the nostrils, over the middle of the bridge of your nose, over the mouth, over your chin, so that the bar, the metal bars are across the bridge of your nose. Some people wear it upside down and stuff like that. Yeah, and form the bar. Before I put the ear loops on, I form the bar around the middle of my nose, and then pull my hands around the top so it makes a seal on top of my cheek. Wrap the earpieces. Most of these are rubber bands, and then pull it down so it's over my chin and on the sides of my cheeks. That's about the best you can do.
Yeah, absolutely. Obviously, eating healthy and staying hydrated, getting good sleep are also good things to keep your immune responses strong.
Right, that's correct. Stress, unfortunately, which none of us are avoiding,
right,
is a big problem eventually. Chronic stress, especially for immune system suppression. Elderly folk tend to have, even without disease, tend to have less of an immune response than younger folk. People that have had chemotherapy recently can have suppressed immune. People on steroids, not really inhaled steroids, but oral steroids or IV steroids. Some people are born with immune deficiencies. People with chronic lung and heart disease. All these people are increased risk of from the flu and COVID and RSV of getting sick enough to require hospitalizations.
Yeah. Okay, so just to recap for today, it is respiratory virus season. Cold, flu, COVID-19, RSV are all prevalent right now. The cold, nobody dies of a cold. You can treat that at home. It's typically not going to have fever or GI symptoms associated with it as well. Can often be confused for seasonal allergies. Flu and COVID have very, very similar symptoms, similar onset typically as well. You need to be tested for these two viruses to see which one you have, or if you have it. There are good antiviral drugs for both the flu and COVID to help lessen symptoms and shorten the duration of your illness.
Yes.
RSV is very, very infectious, particularly young children and elderly people are very susceptible to catching this. It's also really going around right now as it is easily transmissible from hard surface to face to mouth. So definitely, kids playing in close quarters and can impact it. Get your vaccines regularly. There are vaccines available for flu and COVID-19. There's no vaccine for RSV or for the cold.
That's right.
Getting regular flu and COVID-19 vaccines help you, maintain immunity across different seasons of these viruses, but it also, helps if you happen to get these viruses. It doesn't necessarily prevent you from getting the virus, but if you happen to get it, it will blunt the severity and duration typically.
Yes.
Obviously, if you think that you have any of these things, please contact your doctor. It's always good to stay keyed in there, so you can get the appropriate testing or start the antivirals, which really, you should start pretty quickly after symptoms start, and they can really help you feel better as well, too.
And call ahead. Call your physician's office or your ER or your urgent care. Call ahead instead of trying to go there and wait it out in front of a bunch of people. They'd appreciate that. And if you have now, lots of people have masks because of coronavirus the last couple of years. Mask up if you can leave the house, and if you have to leave the house and go to your physician, go ahead and mask up. You don't need to put on gloves or anything like that. Just you don't need to double mask.
Yeah, well, that's good. Keep up your good behaviors. Eat healthy. Drink plenty of water. Try to minimize stress. Get plenty of sleep to improve your immune response anyway. And then also, wash your hands. Wear a mask if you're feeling sick at all. Wear a mask or stay home. And if you've been exposed, especially to COVID-19, and you're not sure if you're going to pop positive or not, definitely wear a mask during that time too. So
that's right.
I'm glad we did an overview of this. I feel refreshed. Yes. For the season.
Well, I'm sure we probably have to do it every year. I'm sure we'll have something a little to add every year.
Something to add every year for sure. If anybody has any questions for the doc about any of this information, you want to know more about the resources, which obviously we'll have in the podcast description, links to the things we referenced today, shoot us an email at notyourdocpod@gmail.com. That's notyourdocpod@gmail.com. You can find us on Facebook at the Not Your Doc Pod. You can find us on YouTube, Not Your Doc Pod. We're on Spotify as well. Thanks for listening, and we're going to bring you more again. Thanks, Dr. Tadros.
Thanks, Vanessa. Good times.
Take care.
This previous podcast represents my opinions and the opinions of my guests. This is not medical advice, and I'm not establishing a physician-patient relationship with any listener. The content here should not be taken as medical advice. The content here is for informational purposes only, and because each patient is so unique, please consult your healthcare professional for any medical questions that you may have.